Good afternoon and welcome to Facebook Live with Chisholm and Kilpatrick. I'm Courtney Ross. I'm joined today by Elise Goloski and Alex Sachs. And today we're going to be talking about diabetes. So I want to get started just by generally talking about what diabetes is. So there's two types, type 1 and type 2. For purposes of this broadcast, we're going to be really focused on type 2 diabetes, which is a chronic condition that affects the body's blood glucose levels due to either an insulin deficiency or being insulin resistant. Type 1 is a similar condition, but it typically develops in adolescence, so you usually have it earlier on in your life. And for VA adjudication purposes, there's actually a distinction between type 1 and type 2. And we're going to get to this later in the broadcast, but just to give you an example, type 2 diabetes is a condition that VA will presume is due to a veteran's exposure to herbicides and Agent Orange, where type 1 is not afforded that same presumption. So the severity of the condition can vary case by case. Some individuals are able to control type 2 diabetes with a restricted diet, while other people have a more difficult time doing that. And as the condition progresses, it can become a little bit more difficult to really control those blood glucose levels. So for veterans who may already be service-connected for this type of condition, it's important to kind of monitor how your disease progresses, because the more severe it gets, you may be entitled to a higher rating from VA, which means more additional compensation for that benefit. And that's kind of a good segue into the next thing I want to talk about, which is how VA rates type 2 diabetes and what they're looking at to decide what rating is appropriate for a veteran's condition. So Elise, can you talk a little bit about that?
Sure. So there's various different ratings that you can get for type 2 diabetes. They range from a 10% rating all the way up to a 100% rating. And as Courtney was touching upon, it really a big factor is how you are having to control your diabetes. A 10% rating, for example, would be somebody who can control it just with a restricted diet, whereas a 20% is someone who requires a restricted diet, or they require a certain exercise routine, or they require insulin. Then we go up to a 40% based on how often you might need that insulin. If you need it more than just once a day, you're starting to look into those higher ratings. You're also looking at some reactions that you might have in the higher ratings. For example, if you are hypoglycemic, if you have those type of reactions, that's when you're going to start getting into those 60% ratings, 100% ratings. You can also suffer complications from your diabetes. For example, we're going to touch upon this a little bit later, but maybe if you have an eye condition or a neuropathy condition, the rating criteria right in the criteria directs adjudicators that they are to rate those complications separately, so long as they basically come up to a compensable level. But if you have if you have complications rather, that are not what VA would consider compensable, that might entitle you to a 60% rating. Hospitalizations also come into effect. If you are having to be hospitalized, that might warrant a 100% rating. So these are just the factors, but a very common theme that we're seeing, as Courtney touched upon, is how you are actually having to control and manage your blood sugar levels.
Thank you, Elise. So I want to back up a little bit. We've talked about how VA rates diabetes once a veteran is service connected for it. Let's back up a little bit and talk about ways to actually get service connection for diabetes. So Alec, can you talk a little bit about one way that a veteran might be able to seek service connection?
Yeah, of course. So as we touched on, the most prevalent way we see of veterans becoming service connected for diabetes related to service is due to the exposure to these harmful chemical herbicides, specifically Agent Orange. And that would be for veterans who served with boots on the ground or in the inland waterways of Vietnam, specifically between these certain dates that VA has set, January 9th, 1962 and May 7th, 1975. If you were a veteran who served, again, boots on the ground in the Republic of Vietnam or in the inland waterways, which I'll expand upon a little later, VA presumes that you were exposed to those harmful chemical agents. And if you have the diagnosis of diabetes, then you're entitled to service connection and disability compensation benefits for it. So for a long time, no one really knew what these inland waterways were. Up until recently, really, last year, the Federal Circuit, in a case called Procopio, decided that under the statute and the term of Republic of Vietnam and what does that refer to, it's both its landmass but also a 12 nautical mile territorial sea, seaward of the demarcation line of Vietnam, which is a little technical. We have some literature on our website and some visual representations that can kind of help you out with that territory off the coast of Vietnam. So Congress essentially codified the decision in an act called the Blue Water Navy Vietnam Veterans Act. So VA terms it if you were a Blue Water Navy veteran, again, who served within this 12 nautical mile range, between the same dates, again, the January 1962 and May 1975, you're entitled to that same presumption that your fellow veterans who had boots on the ground receive. So again, that's the most common way, is this exposure to Agent Orange as a Vietnam-era veteran. But in addition to that, veterans who flew on or worked on specific aircraft C-123s, between 1969 and 1986. These were aircrafts that were used to spray the actual chemical Agent Orange over the forested areas in Vietnam during Operation Ranch Hand. So if you were a part of that operation and are working on those aircraft, that presumption can extend to you. We have information again on that on our website. So in addition to that, we have veterans who served near the Korean DMZ or along the DMZ between September 1967 and August 1971. Actually, the Blue Water Act recently expanded those dates as well. So those are the dates, 1967 to 1971. And then last we have Thailand. If you served on or near Thailand military bases between February 1961 and May 1975, again, Agent Orange was used to spray the surrounding forested areas in preparation for attacks from the enemy. So there's bountiful evidence that veterans serving in those Thailand military bases were exposed to Agent Orange, and they are presumed to have the presumption as well. So those are all the chemical herbicide Agent Orange links. In addition to that, I'll just note that VA considers diabetes a chronic disease under 38 CFR 3097, both of them, I think. So if you develop diabetes within a year of your discharge, you may be entitled to service connection compensation benefits for that.
Yeah, and excuse me. We've recently done some other Facebook Live videos that specifically discuss the Blue Water Navy Act and the recent extension of the presumption of exposure to those veterans as well. So you can check those out on our website as well. So you talked a lot about presumptive service connection. One other way that you may be able to seek service connection for diabetes is as a secondary condition. Secondary service connection means getting service connection for a condition that developed not as due to your service, but instead as due to a condition that you're already service connected for. So one of the most common ones that we see with diabetes is the development of diabetes being caused by sleep disorders or sleep apnea. VA and DOD, or the Department of Defense, actually did a study that showed individuals with sleep apnea or poor sleep quality typically develop diabetes. So for sleep apnea, it actually increased the risk of diabetes by 78%, which is a pretty significant number. And those that had trouble sleeping had a 21% increase in terms of a risk of developing diabetes. So there's a significant connection there, and that's just one example. It could be possible that there's other conditions that may cause or lead to the development of diabetes as well. So in addition to considering trying to connect diabetes directly to your time in service or as a presumptive condition due to exposure, you should also consider whether the condition may have developed later in life and may be connected to a condition you're already getting service-connected benefits from VA. Another example is actually drugs that may be prescribed to you to treat things like high cholesterol or heart conditions. So if you have if you're already service connected for a heart condition, there may be certain drugs that you're taking for that condition that can actually increase the risk of diabetes as well. There's medical literature that supports a possible connection there too. So this is just a different way that you may be able to get service connected for diabetes. So just other things that you want to consider as well. A third way, which relates to secondary service connection but isn't exactly the same, is actually using obesity as an intermediate step. Elise, can you talk a little bit about what is meant by that?
Sure. So just as a general matter, obesity is not actually a disability for VA purposes, so you cannot receive service connection for obesity. However, you can use obesity, as you just said, Courtney, as an intermediate step to get you secondary service connection. And this is a really hot button topic right now, and the reason for that is that obesity is very common among the veterans population, and so is diabetes. And the reason for that is that they're actually linked. If you have obesity, you are more prone to develop type 2 diabetes, and a lot of veterans do suffer from obesity due to multiple reasons, whether they have different disabilities that preclude exercise, or they're on certain medications, or whatever it might be. So the court has recently determined that you can't get service connected for the obesity, but you can have that link. So what that would mean is if you have a condition that is service connected that causes your obesity, and then your obesity causes the diabetes, you can use that as a link to get the secondary service connection. So for a specific example, maybe you have a severe knee disability. It prevents you from being able to move around a lot. As a result, you have become obese, and as a result of the obesity, you have developed diabetes. So long as that knee condition is service connected, the diabetes can be service connected. So you can't get direct service connected for obesity, but it is a useful tool to get you service connected for a different condition that you might have developed.
That's really helpful. So something else to consider and think about if you're suffering from diabetes and you're looking for to try to get VA benefits. I just want to pause quickly and remind our viewers that if you have any questions throughout the broadcast, please feel free to leave the questions in the comment section. We'll do our best to answer them as we go. So we've talked a little bit about secondary service connection for diabetes, so getting benefits for diabetes as due to an already service-connected condition. I want to switch gears now and talk about, and Elise alluded to this a little bit in the beginning of the broadcast, conditions that may have developed due to your diabetes. So these conditions you may be able to get service-connected for secondary to your diabetes once that's service-connected. So Alec, can you talk a little bit about what some of those conditions are and what are the most common examples?
Sure. So according to VA, actually, diabetes is the leading cause of blindness, end-stage renal disease, and amputation for VA patients. So some other common conditions we see secondary to diabetes, diabetic peripheral neuropathy, which is characterized by weakness, numbness, pain from nerve damage, and typically we see that in the extremities. There's also renal or kidney dysfunction, diabetic retinopathy, which refers to damage to the retinas of your eyes. Can be caused by diabetes, as well as other eye conditions, actually, such as cataracts, erectile dysfunction, cardiac conditions, such as coronary artery disease, heart attack, strokes. This one's always hard for me to pronounce, arteriosclerosis. It's a buildup of fat, cholesterol in your arteries, so that's kind of linked with the heart disease there. And then hypertension or high blood pressure. And then various skin conditions sometimes as well can be secondary to diabetes. So, yeah.
And so while you may be able to only get maybe a 20% for your diabetes under the criteria that Elise talked about before. If you're also suffering from any of these other conditions and you're able to establish to VA that it is due to your diabetes, again, as Elise alluded to before, you should get separate ratings for each of these conditions, which should increase your overall combined rating and therefore your monthly compensation that you'll get from VA. So it's really important to kind of keep this in mind too. If you do have the condition and you start to develop some of these other conditions, you want to make sure that you're aware of this and possibly filing claims with VA for them as well. So just generally speaking, starting with service connection, if a veteran's seeking service connection for diabetes, what are types of evidence that he or she can submit to VA to help establish the service connection?
Sure, I'd say like the number one type specifically with diabetes is going to be medical evidence, whether it's from your VA treatment provider or from your own private physician. The reason for that being that, especially the rating criteria, it's very technical. It has to do with what you're prescribed, what you're required to do. And it would, while late evidence might be helpful in certain situations, I think you really do want to get some of that medical evidence in for these diabetes cases. Because you would be running into, competency issues if you weren't working with a doctor. Other types of evidence, like you might attend what's called a VA exam. We've done multiple, or we've touched upon this in multiple Facebook Lives. VA exams are extremely important. They will order one for you. If they order one for you, please attend them. And that's going to be another way that you'll be able to get evidence, and they will ask you questions if it's service connection. They'll probably ask you questions about when you or look into your file as to see when you started to experience the diabetes. They will also look and see if you have any exposure or any other risk factors. If it's an increased rating claim, they'll probably be more looking at how you're treating, whether you have weight loss, if you have any hospitalizations, any of the factors that are going to go into what rating you would be entitled to.
Yeah, and you could also consider getting your own outside medical opinion as well. If sometimes VA exams come back negative and don't support your case, so you can get your own opinion, especially if you are trying to link your diabetes to an already service-connected condition, or if you're trying to link some of those conditions we talked about as secondary to your diabetes. For those, you are going to need a nexus medical opinion, specifically attributing those conditions to diabetes or your diabetes to the other condition. And so getting an outside medical opinion might help you to establish that element of service connection. The benefit of presumptive service connection, if you are a veteran who was exposed to herbicides, including Agent Orange, is that you really only need to establish, either show that you fit within the presumptive exposure periods and then the diagnosis, so you don't have to include that nexus element. But for the other service connection avenues, you will. So that's important to keep in mind too. Alec, do you have anything additional in terms of evidence that might be helpful?
No, I just want to echo that. Diabetes is a more specialized condition. As we say, it's really not capable of lay observation. So it's not like an orthopedic condition where your knee hurts, something that happened where residuals from a gunshot wound that cause your knee to hurt. You can't really observe that, so that's why you need a statement from a doctor, whether it be a VA doctor or a private physician, as we noted, and that nexus to either another service-connected condition or service in general. So I think that kind of hits on the key points.
Yeah, I think that's a great transition to final thoughts. Elise, do you have anything to add in terms of final thoughts?
Yeah, I would say diabetes is unique, the rating criteria, in that they do specifically direct the adjudicators to separately rate any complications that you might have. However, I wouldn't just totally rely on that to assume that they will automatically separately rate your conditions. So what that means is I would work with your attorney or your VSO rep and figure out how you want to file claims for those conditions that are secondary. It's kind of it just protects you because even though they're directed to do so, they might miss it. So.
Okay. All right, well, that's all that we have for you. Thank you for joining us on Facebook Live with Chisholm, and Kilpatrick.